I am pleased to introduce Dr. Harparkash Kaur, who is a lecturer in pharmacology at the London School of Hygiene and Tropical Medicine. Dr. Kaur is the principal investigator on a project to assess the quality of drugs in Africa, which is funded by the Artemisinin Combination Therapy Consortium, with an award to the London School by the Bill and Melinda Gates Foundation. Dr. Kaur has published widely on the topics of pharmacokinetics, oxidative stress, drug quality, screening, and management, among other subjects. Welcome, Dr. Kaur, who has traveled from London to be with us today.
Thanks very much, Jim. Good morning. As Jim said, I am Dr. Harparkash Kaur, and I'm a chemist at the London School of Hygiene and Tropical Medicine in the UK. I'm involved in 6 of the papers in this journal supplement on falsified drugs or medicines. I have analyzed antibiotics, anti-leishmanials, and antimalarials using the gold standard techniques that you see here on the slide. And we've also used one bioassay technique too. Only very few laboratories in the world actually have some of these analysis systems. You will have seen in the literature, and you've heard today already, that it's been reported that up to 1/3 of the antimalarial drugs are indeed fake. So we set out to find out exactly what is the picture. We looked at the quality of antimalarials through my project with the ACT Consortium, and the 2 studies that I'm going to present now are one from Tanzania and one from Cambodia, where we collected over 2,000 antimalarials and analyzed them in 3 separate laboratories, one in the UK and 2 in the United States, one at CDC and one at Georgia Tech. So I lead this antimalarial drug consortium program, and we actually did analyze in total 10,000 samples, of which I'm actually presenting 2,000. And the rest of the 4 studies will be actually appearing later. The supplement that is launched today has the first published results from this large program. 2 of the articles, as I said, are from Tanzania and Cambodia. The news is that we have not found any fake drugs. And you'll ask me, why? Well, this is most likely because the previous alarming reports were based on studies that have mostly used non-representative methods without geographical coverage for selecting the drugs that they've actually analyzed. Drug sellers were selected because they are easy access. This is known as the convenience study or convenience approach. In our studies, we were very careful to sample antimalarials in a way that was representative of the country, with the geographical coverage. In Tanzania, we told the vendors or drug sellers that we were going to analyze the quality of their medicines. In Cambodia, we used the same overt sampling approach, as well as the mystery client system, where the actors pretended to be malaria patients and bought whatever drugs that they were given. And both studies used a randomized approach to sample the drug outlets, which is different from the previous studies. So the main finding, as I said, is that we have not found any fake drugs. But we have found substandard drugs. These are branded products from recognized manufacturers who actually have incorrect amounts of the stated active pharmaceutical ingredient. In Tanzania, which is on the right-hand side on the picture you can see, we found 12% of all the samples that we analyzed. This is over 2,000 of them. We found 12% to be substandard. In Cambodia, we found 31% to be substandard. So what are the concerns? Well, the concern is the malaria patient is left untreated. The parasites are permitted to have drug-resistant mutations that develop and then spread. So in conclusion, what we think is that just because we did not find any falsified drugs does not mean that we can be complacent. Systems need to be in place to monitor drug quality routinely. We need drug testing facilities. We need the staff. We need the sampling approaches. And all this comes at a cost. In the end, we need to sample medicines in a representative way and target efforts where they're most needed. More results from our study will become available in time on the ACT Consortium website. Thank you very much.